fruit basket turnover.
We're good.
He's getting ready so we can.
On
On the back, check out the back. I got one.
The Board of Trustees of Crystal City Independent School District will meet in special session at 6 p.m. Monday, June 29th, 2026, at the Administration Building, 613B, West of Olive Street, Crystal City, Texas, 78839. Call the meeting to order at
6:07 p.m.
roll call, please.
Mr. Vince Martinez,
Here.
Mr. Simon Houston.
Here.
Mr. Cruz Mata,
Here.
Mr. Diego Espinosa,
Here.
Mr. Ray Espinosa,
Here.
Mr. Victor Bonilla III.
Present.
Here.
For the record, we do have quorum. Moment of reflection. Item 4, public comments.
No one, sir.
And I'll move on to number 5. Informational discussion, Mr. Joe.
Sure. So, as the board knows, we wanted to find an affordable opportunity for our employees to have health insurance. And we currently are using a broker, Higginbotham. They were given an opportunity to present. We haven't heard from them. We also have First Financial, 1921, and Robinson Brokers here. Just as a footnote, we're using the state plan, the TRS Active Care, as kind of our foundational information as far as rates, what we're looking for as far as our employees. We've communicated that to the brokers. So with that, Robert?
And I apologize, but this is about as big as I could get this printout for TRS.
Thanks, buddy.
And I'm also going to share our current Higginbotham. All right. Again, good evening, Board of Trustees. So we're going to start again. We are looking for insurance brokers. Currently, we do have Higginbotham as our current insurance broker. What I'm projecting up here and what you have in your hands is our current insurance plans that we are offering to our employees. We know that last year and the years prior, the district was contributing, and the employer was contributing $779 towards the insurance plan. We know with the financial struggles and adjustments that we've made, we've knocked that down to $225 per month. With that being said, when you look at the plans, you can pretty much see that the insurance rate is going to go up. In some cases, anywhere from $277, and in some cases, all the way to $554. So somewhere between their insurance premiums, employees were going to see anywhere from $277 increase all the way to $554 increase. What we did was we went around, we shopped around. Mr. Grill was willing to joined the teacher retirement active care plan. So far, we've seen that that was a much more affordable plan for the district. If you see, the current plan reads top to bottom. The TRS plan reads left to right. So the active care primary, which is what they would consider their basic plan, if you see that their employees, the employee total premium for the month is $449. Employee and spouse is $1,348. Employee and children are $849, and employee and family were $1,697. Going on to the next plan, which is our middle plan, the employee would pay per month $586 for employee only. Employee and spouse would be $1,524. Employee and children would be $997, and employee and family would be $1,934. The TRS Active Care HD plan, which is the last plan on the system, is employee only would be $515. Employee and spouse would be $1,391. Employee and children would be $876, and employee and family would be $1,751. What we did is we tried to enroll in TRS Active Care. Unfortunately, we missed the deadline to be able to make that move. We would have to have submitted paperwork and documentation from the district before December of last year. So that's this past year, sorry. So we didn't meet the deadline. However, moving forward, it's something that we can look into. With that being said, we looked at different brokers. Some were advised, some were just that we found. But what we did was we shared the TRS Active Care Plan, and we asked them if they could match or do better. So that was the intent of their presentation today. See if they can match or do better than TRS moving forward. That is the information that they're going to present for you all tonight. Okay. Any questions? I'm sorry, I'm dealing with the leak.
Turn it off.
I heard. So with that being said, we'll move on to our first presentation. Right now we have FFG. This is Mr. Victor Guajardo coming in from FFGA. Just a little background on that. We do deal with FFGA currently through our supplemental insurance. We do the life insurance, we do dental, vision, Itopia, some of y'all that are familiar with that. FFGA does deal with that right now. This is a different sector of FFGA that would deal with medical insurance. So, Vic?
Hello, everyone. My name is Victor Juarez. Nice to see all of you. I'm here because we are facing the task of controlling the premiums, or doing our best to wrangle them in, if you will. There's only a few ways you can really wrangle in premiums. And those ways are direct primary care, getting to the root cause of your employees' health, getting them the care they need when they need it in a time of mass. The other way to get control of costs is going to be through your cost mechanisms. So it's going to be your repricing. Right now you're using Blue Cross, and you've got that network, and all of your claims are being repriced according to the network arrangement that Blue Cross has. Okay. There are other ways to reprice against different networks or non-networks. There's Medicare, there's cash, and then you have the typical United, Cigna, Aetna. All of those things are going to change how much you spend. And that factor that changes is going to be the multiple of the contract that you're in. The third way to control costs and to get ahead of this is going to be through pharmacy. So you've all kind of seen in the news, you've got cost plus drugs, you've got GoodRx, you've got all these different wonderful arrangements up. People are getting the medications they need at a lower cost outside their insurance. So there's something to be said about acquisition of medications. And I hope that serves as proof. So I've named three ways to get a hold of your premiums and improve the health and access for your employees. There's also another way, and it's a way of helping members obtain their health coverage through alternate health plans as well, and that's a form of risk removal. So ultimately, there are 4 ways. It's just which ways are you willing to engage in order to get control of your premiums? My specialty happens to be self-funding by all of the above, taking advantage of direct primary care, using cash and capitated programs to purchase medications, both through and outside PBM through various channels. It's all about acquisition of the medications. It is those things that you need to be aware of. That's going to lead me to this next part. This next part is there are 2 things that compose your claims. You have your variable costs and your fixed costs. Everything that I covered, minus the direct primary care, is going to be a variable cost, okay? So every time somebody goes to the doctor, shoulder surgeries, anything you can think of, if it's a medical claim, that's going to be a variable cost. And the variable is going to be that multiple of whatever contract you're on. It's Blue Cross. Every time they go fill a medication, that's a variable cost. Right? So I've covered these variable costs. The other are the fixed costs, which is going to be your TPA or your third-party administrator. That's going to be who handles the claim every time somebody goes to the doctor. Then you're going to have your PBM. That's going to be every time somebody submits a claim on the pharmacy side of the house, it gets processed and then billed according to that contract. I say all of this because you're going to need to generate premiums that are very, very close to TRS, as close as you can possibly get it. But there is something that you are missing in all of that, and it's that TRS has tens of thousands of people in that risk pool, and you have less than 200 in the risk pool. So immediately, you can begin to understand that the rates that are being displayed there will be significantly different than the rates that you'll achieve through traditional models. Right now, you're fully insured. You're probably facing a premium increase of 20 to 30 to 40%, depending on your loss ratios from the carrier. I don't know what your loss ratios look like, but I'm willing to guess you're probably getting a 30% increase, not seeing any claims. And I can make that statement because that's pretty much all school districts and many employers across the state of Texas and nationwide is seeing those very large increases. So in order to get as close as possible, you have to work backwards. You have to figure out how to change your medical claims, how to reprice them differently, how to change your pharmacy claims, how to acquire the drugs differently, how to improve your members' access to care, how to improve your members' health, which is easier said than done. I can't control anybody who eats certain kinds of foods or drinks certain kinds of drinks, which all result in their health, which all result in some sort of premium expense. But what I can do is ensure that the access to care is there for those members by near-site clinics, on-site clinics, or traveling physicians who come on site once a month, something to that effect. There are many ways that access to care can take shape. You happen to be in the unique position where many of your members are probably traveling outside to get the care. Maybe 2 hours they're driving to get surgeries, to get seen by their primary care, to access a specialist. And so it would make sense to have some sort of near-site clinic or some sort of physician that travels and meets your members where they are. I won't go through the companies that can help achieve that, but the companies that can help achieve that are a fixed cost. You will eliminate urgent care, emergency rooms, overall, some specialist referrals to a certain degree. You think about it at about 30% or so, depending on the engagement that you have. You're not going to catch everybody, but you will catch more than you have. That is one step to reduce those variable claims. That is a subset of claims that will no longer hit the medical plan because now they are capitated. The next set is the pharmacy. Now, many of these primary care have access to thousands of generics. Those generics are going to be purchased through that capitated fee that you pay through that primary care physician. So that's taken care of. That's also no claims that are being routed through the health plan. Next way we're going to do this is possibly exploring alternate network design. Now, I mentioned all the big name carriers, United, Cigna, and the ease or perceived access to care that they all give. Chances are, if you've listened to your members, they've still received very expensive bills for any of their claims. So it isn't as if these networks are a cure to their current predicaments. If anything, they could still be getting in the way. Which brings me back to primary care. Primary care done right with a clinician that your members have a relationship with. The way that I build them, and maybe some of the partners here build them as well, is cash pay. And so when members are being routed through any of the primary care physicians that I work with, we are getting a cash pay price and waiving all deductibles and co-pays and co-insurance for those members. The reason for that is many of the claims, your surgeries, your hysterectomies, anything like that, can be purchased by cash by typically 30 to 50% less than it would be going through the carrier. So it's one way to get control of your expenses. I'll speed this along because I get the hint that you need to talk to other people besides myself. So without data, I won't be able to show you any rates. And it'd be a fool's errand to stand up here and insinuate that I could. But I do know by taking advantage of the methods of purchasing that I just mentioned, in addition to certain risk removal, I can get you rates that are less than what you're currently paying. But remember, there's still variable expenses you will always have to pay for. So whenever you're building premium and looking at that, just work backwards. And you can always figure out the premium from that number. That's all. And questions?
Well, I have a couple. Actually, I have like 11. But I'm gonna, just for the sake of time, I'm gonna lower it down to a little bit. So my first question is, what experience does your firm have working with school districts facing financial challenges or state oversight?
A lot of experience. I've been with First Financial about 3 years. Over those 3 years, schools within TRS, I've probably looked at about 20 of them who are considering getting out. What I do is I build a mock health plan for them. And so I run them through different network arrangements, both regional and national PBO networks, building the TPA, the pharmacy benefits manager, judging the claims, the variable claims, and telling them if it is a good idea or a bad idea to opt out to begin with. 7 times out of 10, it's a very good idea to stay in, because when you opt out, you have to be prepared to actually take control of your health plan. You cannot continue to treat the health plan the same way you did when you were in TRS, with no oversight and no willingness to engage in alternate methods of purchasing, because now you're a part of a smaller risk pool with the same exposure. That means that your costs are only going to go up. So inside TRS, reviewing over 20 groups within these 3 years, some of those groups multiple times, and studying their claims throughout the years. Others, I'm working with several high-risk groups that are small about your size, having to do network design such as reference-based pricing to get control of how much we're spending, so that way we can fix the millions of dollars of deficit that is there. So I hope that wasn't too long of an answer.
My next question is, What measurable savings have you achieved for school districts similar to in size to Crystal City ISD? Can you provide a specific example?
So if you are willing to implement all the things that I've just mentioned, changing the pharmacy benefits manager, controlling the risky population through alternate methods of insurance for them, through reference-based pricing arrangements, through alternate PPM arrangements, you're probably looking at 40% or greater from current spend.
So my next question, I got two more. I think you answered partially of it, but I want to hear a little bit more. Our district has experienced significant financial challenges. What specific strategies would you implement during your first year to reduce our healthcare costs without simply shifting those costs to our employees?
It would be, and I know I keep mentioning reference-based pricing. And the reason I do is because you happen to live in the part of the country that has the strongest reference-based pricing in the country, right? So that's San Antonio and South of San Antonio. You're not going to get very much pushback, if any. 99% of the claims are going to go through. Reference-based pricing has a very, very good hold anywhere San Antonio and South San Antonio. So immediately, it would be moving to a reference-based pricing arrangement that has a fixed PEPM. So there's no percentage of savings that would be built into that. It's always very important because it doesn't make sense to go reference-based pricing and then somebody's taking a 20% of savings or 12% or anything like that. Then you're spending near how much you would have spent had you remained with the carrier. I would also be moving to a different PBM. Won't use the word transparent because now it's just self-told. But to a PBM that can, pharmacy benefits manager, who can help us acquire those drugs closer to acquisition price, using different arrangements to get those. A combination of cost plus drugs or some other mail-in method, a combination of mail or a combination of 340B. These are just terms to you all right now. These are ways to lower the acquisition cost by about 30% on the pharmacy side. And of course, a near-site primary care clinic or a group of clinicians who will travel to you. Those would be the things that I immediately do to control this.
Okay. My last question. What makes your firm different from the other firms sitting here tonight? And you can provide one specific example where your work saved a Texas school district money while maintaining or improving employee benefits.
Okay, so I don't know anything about these other firms, so I won't be able to speak to that. But what I can tell you, what makes us different is the willingness to engage in tools that actually work, like this primary care. Now, you all should have printouts or should be receiving printouts later of different case studies with primary. And it's all really focused on that. It's really focused. Our firm focuses on the member. You start at the member, you build outward, and everything else will take care of itself. If you don't start with the member and you just throw some blanket on it, you're not going to achieve what you set out to achieve.
I have a question, Vince, if I may.
Oh, go for it.
Yes, sir.
And this will be also to the other front chair. As a broker, are you guys aware of any co-ops that exist or coming up, are made up of small school districts? Because this financial situation that we have in reference to health insurance, it's not just occurring here. It's occurring across the state of Texas, as far as I know, especially in small districts. So have you guys heard of any group trying to do a co-op of these small school districts so that when our brokers approach the insurance companies and say, look, it's not just 200 employees. We represent this co-op of 2,000 employees. Is that happening? Are you guys aware of it?
There are some co-ops in very South Texas between two school districts that used to be much larger. I'm not sure how open they are. I can't speak for them. I'm not directly involved in those co-ops. I'm just aware of them. There are other risk pools that work with school districts that are high risk, such as yours, and are facing these very large premium increases that I'm sure other brokers or consultants will speak to today and wouldn't want to steal their thunder. But there are certain risk pools that specialize in the types of claims and types of members that you have. As far as other co-ops, not that I know of, other than some that exist for charter schools in the Northeast. But if I would know of three immediate ones, and if there was significant interest, that could be something that is explored. It would probably lead to about 1,000 members or so.
Let's not go near the risk pool. We got enough issues as it is. We're having to deal with that kind of stuff. But I was just thinking in general, with groups of school districts our size, that I know as individual school districts will be listening to the same thing you're telling us right now. And so maybe they can pool the resources on their employees to make it look more attractive so that rates, et cetera, will be more reasonable.
Yeah, so I just had, for clarification on, I guess on variable costs, I know there's medication. Did you mention, I guess, eliminate ER visits? Did that mean coverage, there wouldn't be coverage for ER visits?
Absolutely not. So there must always be coverage for ER visits. There's something called EMTALA. It's a law. So whenever a member presents to an emergency room, they can never be turned away. Right? They must be accepted regardless of their ability to pay. What I'm mentioning here is, and I'll give you a few examples. So in some groups that I've worked with, non-school districts, the members treat the ER as their primary care. There was a pregnancy who would go and get her checkups at the ER because she couldn't afford the copay. And it was only a $30 copay. But it was costing the plan fives of thousands of dollars. So when I say reducing ER visits, I mean by providing access to care for the members, they won't have to engage in practices in the ER that could easily stay outside of the ER. So it's all about triage, if you will, and helping those members triage themselves and know where they can get care. Now, obviously, if it's a car crash or a gunshot wound or stabbing, that's very ER. If it's some sort of blood pressure with dizziness and some fainting, that's very ER, right? And there are certain things to look out for. But a member going to the ER because they can't afford a copay for a regular doctor is very preventable. Or members who go to the ER because they suffer extreme allergies, right? There's another root cause and getting to the root cause. So by working with a advanced primary care or direct primary care or something to that effect, it's getting to the root cause.
Or like a preventative type thing?
For preventative type thing.
What's the other one in between,
Urgent care.
urgent care?
Yes, sir.
That's the one between going to your primary doctor in the ER and just go to the.
Through the urgent care. And there's a lot of debate on urgent care itself, right? Because it sits in this nice little sweet spot of you're going to need 2 or 3 stitches. Do you go to a primary care who can get you glued up, or do you go to the emergency room? Or it's the urgent care recognizing that there is a life-threatening acute event occurring and getting you over to the ER. So there is a balancing act, a spectrum that a health condition can occur in and getting you to the right place.
As far as when our employees would reach out to you, will they be able to contact you directly, or is it going to be contacting the TPA and going that way?
So it would always be contacting the TPA and the customer service, but I'm always available to employees. For example, for a city that I work with, there is a a physicians group that is very, very hard to contract with. And so while it took about 3 months to get that direct agreement with that physicians group, I was taking calls from a few employees almost daily as we worked through that. So they'll always be able to contact me, but I'm not the right person who can probably resolve their issue unless they're not able to get a hold of the right person.
And how is your company paid? Is it percentage based of claims, or is it a direct cost, a fixed cost per applicant or per employee?
Right now, we serve as the supplemental TPA Crystal City. So what that means is we've taken the position to waive the fees for the medical consulting. So I am on a fixed salary providing these services. Now, there are other arrangements where we will build in a fixed fee for larger accounts. That is, the accounts know about it, and they pay us directly. We don't take any money through any of the TPAs, the PBMs, the stop loss, or any vendors. So if there is money to be paid, we would know about it.
Would our district fall under one of those?
You would fall under a $10 minimum if we were to build this for you.
That's all the question I have. I don't know if anybody else has questions. Mr. Go, do you have questions? Anybody else?
Oh, sure.
No? All right. Thank you for your time.
Thank you.
Thank you.
Who's this?
First Financial?
Yeah, First Financial.
Next, we have 1921 consultant.
That's just a casual reading to help get engaged here.
Thank you. Thank you.
It'll actually be keep the binding down, keep the binding towards you, flip it that way, yes, sir. And so, President Martinez, thank you, members of the board, for having us. You'll hear from a few different people from our team, frankly, because we've got a big team. And we want to do a few different things for you. We do want to do it really well. I'm JJ Weeks. I'm actually the CEO of 1920 Consultants. It's my job to kind of kick us off and get out of the way and let people that are better at this do the talking. But I'll tell you, I want to set the stage of it. And I love the questions thus far. Every conversation we've had in Crystal City, it's been around two things: pricing and pricing. It's been those two things. We understand the objective very well. I look forward to answering the same questions y'all ask. I assume you're going to ask those to the other vendors, as you should. But really quickly about 1921 Consultants. We're based out of New Braunfels. We're born and raised there. Between ourselves and TEP, we have right at 35 employees. We want to be that really nice sweet spot for you, to where we're that boutique firm where you can call into our office. I'll get ahead of that question. You can call into our office. No wait time. There's no phone tree. There's no dial 9 for this. You actually talk to a person. Not AI. It's a crazy phenomenon in today's market. You're going to hear from TEP. They're our third-party administrator, TPA, because we did hear rumblings talking to your team around administration and what it was like to manage the billing, what it was like to make sure the people that aren't a part of your school district are not a part of your plan. Doing a brief audit, we found that there are people on the side of your plan that, hey, we were told they hadn't been here in years. Well, we need to fix that. That's the job of TEB, and the way that our marriage works is they help us, because you're only as good as your TPA, you're only as good as your vendor partners. They help make sure that is a seamless experience on your administration, and our job is to make sure that we're delivering the best possible product to you at the best possible price point. The gentleman from FFGA is correct. We don't have numbers to you today. We do have some information around your claims. We've got strategies there. We've got like examples we're going to give you to your data about how we're going to help you specifically help your staff. But I want to set the stage there. And lastly, I want you to hear this is we've been in boardrooms before where there's been budget deficits and there's been nervousness in the community. There's been anxiousness around what is this thing actually going to look like? So we've been in this spot before. And one thing I want you to know from the top of 1921 down to our 37 staff that are going to support you every day is we get it. We understand the community is looking at you all to make some really hard decisions over the next 60 to 90 days, and our superintendent and making sure your enrollment is in a favorable spot. I want you to know that you will not find another group that's going to work as hard as we're going to work. We take it incredibly, incredibly seriously. So that being said, I'll let my other team members talk about when to set the stage, and we'll all be up here to answer your questions post presentation.
Thank you. So, for President Martinez, Superintendent Krill, members of the board, thank you so much for your time today. As JJ added, my name is Eva Enriquez. I am with TEB NHR. And to add a little bit of background of how I came about to here, I actually used to work for a school district. So I was a benefits manager for a school district many years ago. And I actually went into this space with one goal, and that's to help our public sector groups. So I wanted to add to that because, like JJ said, we get it. We get the administrative burdens here. We get how hard it is to, manage benefits overall. Our employees are most of the time not well educated on what health insurance really is. So education is something that's extremely important and part of our motto within TEB in 1921. So I did want to add on the slide. So we are going to be focusing on the administrative side, right? So we're going to do a lot of the consolidated billing work, a lot of the administrative work, because we take a holistic approach on saving you all as many dollars as possible. One of the things is when bills are not paid correctly or invoices aren't correct, you're basically putting a lot of money out, money that can be kept within the district and used for other services, right? Or just used for the district itself. So what we do is we create one full bill and we reconcile that. So TEB actually stands for Technology Enhanced Benefits, and we use technology in order to help that basically leverage that billing and reconciliation. So we'll create one full bill and we'll tell you, okay, these are all of the employees that you are good to go, and these are all of your discrepancies. Those discrepancies will then be sent back over to the carrier and essentially be dropped off from the bill, or if it's the other way around, because I've seen it as well, where there's an employee missing from your bill, which means they're not covered. So that's a big issue, right? We got to make sure that those employees are essentially covered timely, because they can actually need that benefit since their effective date. So we want to make sure that those are all added and we keep in compliance within all of those. Okay. So I did also want to add, we do administration on the open enrollment side as well. So for open enrollment, we make sure that all of the employees are well educated. They know what it is that they're enrolling in, and not just blindly enrolling into something that they really didn't know what it was. So education is #1 top priority for us, to make sure that your employees know what's going on and how these benefits work. That in turn helps your employees really make a wise decision as to what's best for them. The other part is, I already told you, experience in terms of school districts. I worked there for very many years. Not only did I work inside, but I've also worked for districts on this side as a vendor as well. We take a white service or white glove service model, which means, back to what JJ has said, we actually, teach our employees. If they call, they're going to get an actual person. They're not going to get just a random answering service that, they're not going to know who they're talking to. With us, they know exactly who they're talking to. Okay? And that in turn adds to our cost. So cost efficiency, it just brings it all together. So now I'm going to bring it back over to 1921, who's going to address the other pillars of what we're talking about.
Awesome. Appreciate that, Eva.
Yes, thank you.
Superintendent Grill, President Martinez, the board, really appreciate you having us out here. Really excited. She just addressed the billing and reconciliation. I want to make sure we cover that. That was huge in talking to y'all's team. That was a huge headache. I want to make sure we got that resolved. The next big line item, where we sit with Blue Cross today. I really got two different strategies that we're going to talk through. Okay, number one is the stay with Blue Cross and negotiate a strategy. Okay, number two is the RFP process, right? So we already have all of y'all's claims data. We have your census, you're out to bid. We're shopping with over 27 different carriers right now. Fully insured, level funded, self-funded, captive, you name it, we're shopping it. PBMs, et cetera. But everything that we're doing is to match TRS. That was our marching order. Zach, man, we're about to cut our health insurance budget in half. We have got to match TRS or else next year that's where we're going. We missed the boat this year. We need a solution for the next 12 months. Okay. I'm going to walk y'all through what that's going to look like. I wanted to show y'all a few of these slides. We're matching everything that we have out to bid now is matching TRS. So it's going to show you. I want to be transparent. The TRS plans are going to be a less rich plan option than what y'all have today. So you will see immediate savings just by diluting those plans down. Right now you'll have 3 really rich plans, 2 PPO, you got in and out of network coverage, really low deductibles. TRS, you've got 2 HMO plans, right? No out of network coverage, you've got a high deductible health plan. So you're going to see some savings in just transitioning that plan. Okay. Now, what I want to show y'all is any broker in America that has a health insurance license can do it. I can go to Blue Cross, I can go to United, Cigna, and I can dilute your plan down and I can save you dollars. Okay. What's going to differentiate 1921 is these next few slides on how we actually drive impact to our claims. Okay. To our member experience. Okay. That full market today, I want to show you, these aren't all the options that you guys are going to always be presented. I want to let y'all know that we have experience in the self-funded market, captive market, fully insured, level funded. Okay, just got off a group with a client yesterday that we took unbundled, level funded, reference-based price, and we're going to save them $1 million a year. I don't know that that's the right fit for you guys today. I'm going to walk y'all through what I feel like is. Okay, this next slide right here, it says your renewal. Y'all see the slide? One more slide. There you go. So, looking at what we would do based off y'all's claims data today. Yeah. Based off y'all's claims data today, with Blue Cross, you're running at 100% medical loss ratio. I'm not going to divulge any HIPAA information. I know y'all aren't certified. Okay, what that means is, based off y'all's premium, you have paid out the same amount in claims, the exact same amount. So Blue Cross is operating at a loss rate. They're going to hit you with an increase. Period. That's what they're going to do. Now, Zach, what are you going to do to help us to just negotiate with Blue Cross? Well, when looking at your claims data, 3 of your highest claimants are no longer on the plan. Y'all have had some turnover, right? Of those 3 highest claimants, $550,000 of ongoing risk are not going to be on your plan today. So now your adjusted MLR when I go to shop you is 70%. Much more advertising in the open market than it is today. But it's my job as a broker to show that to Blue Cross and to show that to the open market so I can help negotiate down Blue Cross, just where y'all are currently at today, right? So when we shop all those 37 different carriers, I'm not just doing that because I'm going to show you them. I'm going to take those better proposals to beat up Blue Cross. We're shopping y'all fully insured, okay? Another big piece is Medicare. It's a great option for staff, right, that are over the age of 65. Y'all have some staff that are over that 65 age. If we can help provide a white glove service to concierge under Medicare, those are typically our higher risk staff. That's going to help alleviate some risk as well over time. And our goal is to help lower that claim spend, help us with better renewals. Okay. Now, flipping to the next page, I want to talk to y'all about some really cool programs that you have built into Blue Cross today that a lot of folks don't know about. Okay. What y'all spend today, y'all's musculoskeletal spend is up 188%. Big time, right? This is your sprained ankle, back injury, etc. Right now, we have a direct contract with Orasi, which is a great provider. I don't know if y'all have ever used Orasi. You can go there for $0 and get all of your musculoskeletal care taken away, and it's going to lower that claim by about 30 to 40% by going to seek their care. Another one built into Blue Cross is Hinge Health. It's a great virtual option for back and joint pain that is resolved without pharmacy spend or surgeries. Right, so we see these claims. What programs can we implement to lower that claim spend to get us a better renewal? Right, and these are built in y'all's program today. Another big one, GLP-1s. About $150,000 in spend on GLP-1s. It's our #1 RX drug. What can we do about that in our current plan today? We've got Wonder Health. We've got Twins Health and Omada. These are preventative care for diabetes. These are concierge services for our GLP-1s within our Blue Cross plan today. We don't need to change the wheel, but these are built into our plan today to help us lower that spend. Excuse me. These last two are really cool. Catapult Health. They say give you preventative checkups and help to audit our catastrophic claims. A lot of times we get a big time cancer, we get a NICU claim. A lot of times they are misbilled. Sometimes they'll charge you $300 for an Advil, right? So if we can go in and utilize this lever with Blue Cross to lower that claim by 20%, nickel and dimes, where we can save $10,000 here, $20,000 here, that's going to make a real difference, not only this year, but in the years to come. Okay? So that's just within our Blue Cross plan today. Any questions on that before I move on? Okay. So our goal today, right, we're at 10-1 effective date. I talked to Superintendent Groh, he said, hey man, we need to get on something now. We don't have time to wait. Our plan today would be to implement, one, to negotiate with all these carriers, provide y'all the best Blue Cross rate that we can with TRS. Look at the open market, see if there's something more competitive that's not going to cause a ton of disruption. You guys are in an area where there's not a ton of providers, frankly. Access to care is tough. We have to make sure we are aware of that. But turn on these $0 programs. And I don't do that by talking to you folks in this boardroom. We're going to do that by educating our staff at open enrollment. If they don't know about Hinge Health, they don't know about Nomad Health, they don't know about all these programs, it's not going to do any good. So when our staff comes out with TEB, we have 5 people sitting with each one of your staff members to help them to educate English and Spanish, help them to enroll, help them to understand their health insurance. That's going to make a difference. Okay, so that's number one. Number two, we're going to talk through utilization, right? Fewer surgeries, fewer MRIs, fewer ER visits. Hey guys, we're going to have to educate around, let's go to the urgent care when it makes sense to not go to the ER, right? Maybe let's build out a direct contract. Say right now, I just got done building out a direct contract for a group out in Laredo. Laredo Medical Center owns the network out there. They own the marketplace. For a company I'm not going to disclose. If you want to get an MRI, surgery, or X-ray, you can go to Laredo Medical Center, $0 cost, and it's going to lower the claim by 40% because we got it on X percentage of Medicare. Those are the things that we can do in y'all's neck of the woods, things we do every day. Okay. Once we negotiate that and we see our claims loss ratio go down for this year, negotiate a more healthy renewal, these are things that we're going to be implementing throughout the year. We're going to be meeting with y'all's staff quarterly to discuss claims. Monthly, when we see a high cost claim come up. Because guess what? We can implement these things at open enrollment, but if in 3 months we got a big catastrophic claim and we see that musculoskeletal coming back up, what are we going to do to attack it in month 3 as opposed to waiting for the renewal to come out? So we can come out and do on-site education sessions with staff, sending out flyers, sending out webinars, etc. And then, man, the goal is to try to find better health insurance for your people at a better rate. This year, the plan might be to just match TRS, whereas next year, it may make sense to look at some alternative options. Right now, we just have to get to a place where we can have a sustainable health insurance plan before we start implementing a ton of these outside-the-box strategies that I think you guys can be built for down the road, but not in the current state that we're in. I know y'all were previously self-funded. I know that was a touchy subject, and I know that can be very volatile, especially as you were at around 300 staff and now coming out of 200 and potentially lower. That can leave you guys liable for extreme volatility and then very big costs. Any questions on that? Just to drive it home, again, we're going to match TRS. We're going to negotiate your renewal with better data. We're going to coordinate Medicare with some high-cost cases. We're going to try to redirect some of that spend over those high-cost ticket items with those point solutions. And we're going to negotiate our butts off with the market. Like I said, every broker with a health insurance license can get you a proposal from Blue Cross and at that. But what's going to make the difference is how we affect those claims today and in the years to come. So, again, our partnership with TEB in-house, we're going to be running your health insurance. They're going to take care of the billing and reconciliation. You're going to have one single point of contact to handle for your staff. They have to call into our office. Account manager, they're going to have a full team to make sure they're taken care of. We're going to come out on site to educate and enroll your staff and implement a sustainable health insurance plan. Does together. This last piece, I wanted this in here for superintendent. He was really big on timelines. Man, our timeline is huge. Right now, we're behind, frankly. Our typical process, our renewal cycle starts out 120 days from the effective date. Okay, we look at our claims, we deliver y'all, what our in-house underwriters will say is the renewal. We've already been talking to your staff quarterly to discuss claims and what the full market looks like. Let's take a look at a direct primary care. Let's take a look at level funding. Let's look at these options. We don't have time to do that right now, to vet all these options. But now we would like to become, and I'm sure many of the other firms would, to become that broker of record, to begin acting on y'all's behalf. You can negotiate with Blue Cross as early as tomorrow. July and August, early July or middle of this month, I'd like to present y'all with the final proposals. Walk through what that looks like on every single line item. Execute our open enrollment between August and September. Again, we're going to have that Spanish and English opportunity. Make sure that when our plan goes live in October, we've got a clean bill, a clean reconciliation, and then we begin our quarterly cadence with your staff. Meeting post-enrollment to see what we did right, what we did wrong, what we can do better next time. Monitoring claims to make sure we're building out a sustainable health plan. So that's a lot of our plan. Do y'all have any questions for us in TEB?
Actually, you answered pretty much that I even asked, so that's pretty good. Yeah.
I have a question. Within the plan, do you have any prevention, like in TRS? I mean, there's several prevention things that, for example, you want to check your R or something or whatever.
Yes, sir. You know, a lot of times, especially in year one, we try to use what's already in place. Blue Cross has that today. It's not a 1921 or a TEB thing, to be frank. I mean, Blue Cross has a ton of these things inside the program. You know, Zach mentioned a lot of those tools: Hinge, Wonder, telemedicine, you know, urgent care incentives. You know, there's Blue savings programs, there's Blue rewards. They're all there today. You could be doing them yesterday. But is the partner there to make sure that you know that they're there? Are they coming out in open enrollment? Are they incentivizing it? And frankly, are they reviewing it? Is it one of those things where we just come in this time of year and make a nice song and dog and pony show to you guys, and we'll see you again next year? It's no, we're actually on site. We're meeting with your team every 90 days. Hey, here's some opportunities to use this. Can we come back out to a teacher training? What does a newsletter look like? So the answer is yes. Every carrier's got them. It's just about actually delivering to the staff. Yes, sir.
Got examples of some of those prevention type plans or exercises that they do?
Yes, sir. I mean, the direct primary care is a great solution. We've done that a number of times. All preventative care is covered. I mean, that's an ACA mandate. You know, so number one is making sure people know that. You know, hey, look, you can go.
Yeah, educating.
You know, you can go and you can get your preventative care done at no cost on your health insurance. That's an ACA mandate. Even a high deductible health plan, you know, you're required to do that. So you can go get your women's well check, men well check, your routine annual physical at no cost today.
You'd be surprised how many people, when we sit down at open enrollment, have no idea. What do you mean? Yes. When's the last time you saw your PCP? Yeah. Hey, when's the last time you got a checkup? When's the last time you got your blood work done?
Telemedicine too. I mean, you know, in an area where you know, you're in a rural area, telemedicine is incredibly popular. You know, but how do we make sure that our staff knows about it? How do we do it?
That would be part of the education y'all would provide?
Yes, absolutely, yes, sir. And not only at the open enrollment, but throughout the year.
Good, yeah. Thank you.
Yeah.
Just the only question is, you guys are paid with a fixed cost or is it?
Absolutely, yes, sir. Yeah, flat fee, yes, sir. Yeah, so all our compensation is built inside the health insurance plans. When we give you the full proposal, it's all detailed incredibly clearly. You know exactly what we get paid. The broker services we don't bill on top of the disclosed commission. We don't get paid stop loss. We don't get paid PBM. We don't get paid any of those things. It's just a flat fee that you know up front. Yes, sir.
So when you come in, you're going to explain the 3 plans to each individual, each employee.
Yes, sir.
What choices they have.
Typically what we've done in this type of setting, I think of, I always think of George Gervin School District. That's what I always think of because I love their staff over there. But we go out to like teacher orientation. I'll get on the microphone. I'll talk to, 250 staff or so. And from there we break off into, they typically give us classrooms. where we'll have, 6, 7 classrooms set up for privacy and different conversations.
So they will have actually physically see what the difference in the plans is. The plans are.
Then they'll actually physically have one-to-one conversations.
Yeah.
And so they'll hear a group presentation, then they'll break off to a classroom and they'll hear, okay, here's the presentation again. Tell me about your family, tell me about your budget, tell me about, how this works for you. What are your health challenges? How do you plan to use the health insurance this year? We actually educate them while enrolled.
You won't try to sell the best plan.
Yeah. Well,
Because frankly, there's going to be a big change.
Well, that's the conversation of how do you incentivize the base plan to your contribution? Do we load up a high deductible health plan? Do we make that richer for your staff? And those are legitimate. I know you kind of said it tongue in cheek. Those are legitimate conversations we have with you all. We bring ideas to you to help make sure that your dollar is stretched as humanly far as possible. And not that your dollars, their dollars. Because he mentioned, obviously, with your contribution coming down, the per paycheck deduction for your staff is going to be quite different. There's going to be some shock there. And so it's, how do you white glove that transition for your staff to where, they understand the reality that the ISD is going through, but also the reality of, hey, we're not left out in the open ocean by ourselves with high waters. There's someone there. There's a lifeguard that can help us.
Because I think, I might not be too sure, but I think last year or the past year, only one guy came in and he did it in a hurry and left them with a lot of questions versus explaining the options.
And I think I think we can brag a little bit on our size. I think we're that right now. Our market niche is we're large enough to bring in these big time resources, preferred carrier status with every carrier. We have business in 18 states. We're licensed in 38 of them. We have that broadness. We also have 38 employees that reside in Texas. That come out and they help their staff that have that great desire to help and answer the phone.
And there's multiple options for education, so it doesn't just have to be on site. People like technology as well. So if somebody doesn't want to come on site and they want to do it from the comfort of their own home, you can definitely do so as well. So they'll have those options.
I think what they complained about last year is that only one person came and he rushed it. And they didn't fully understand what options to.
Got it. Okay.
Another example of, our enrollment process, we represent a ton of municipalities and firemen. They got 3 shifts, right? A shift, B shift, C shift. They're spread out across 5 different stations. We sit down and you can control every single one of our clients. We will sit down with every single firefighter to walk them through their health plans, A, B, and C shift at their different stations. That's something that really matters to us because at the end of the day, y'all are going to keep us if your rates and claims remain low. And the best way that we can drive that home is with the end user by educating them. So,
thank you.
Let me make sure, I heard right.
Yes, sir.
You mentioned that our claims went lower because of before, we had very high claims and no longer will those be there, which will
yes, sir.
help.
Yes, sir. So as it stands right now, every dollar you paid Blue Cross paid that same dollar to clinics and physicians and hospitals. So Blue Cross didn't make any money. They worked the whole year for free. Your MLR was almost flat. But when you look at the data actually maybe tells a little bit of a different story. You've got a couple high claimants. Your top 3 are actually no longer on your plan. So if Cigna, I'll throw that name out there, looks at your rap sheet and they say, well, Blue Cross didn't make any money. We've got to rate up a little bit to make a little bit of money. Well, no. The highest risk inside the plan is no longer present. And so what we call your high claim adjusted medical loss ratio is actually close to 70%. There's quite a bit of money there left for a carrier to make a little bit of money. And so, so that's that's right out of the gate. That's not anything 1921 did. That's, the good Lord did that for us. But we have to know that. We have to take advantage of that. We have to have the skill to go to the carriers and tell that story.
Will each employee get one of these?
Yes. It won't be that presentation, but every employee will have a document that we walk them through.
Because, we're making such a big change cost-wise for the district's insurance. I think it's really good the way you really really talk about every single thing. I mean, they need to hear that with something new like this and what they're paying.
I agree.
And secondly, on our enrollment platform, it actually shows them a before and after screen for their personal data. So it'll say, Miss Peggy Young, here's what you had last year, here's what you're paying. Miss Peggy Young this year, here's what you have, and here's what you're paying. They see it side by side.
Okay, thank you.
And that's gonna be the education.
Yes, sir. You got it.
That the staff will receive.
Yes, sir.
Because I mean, whatever we approve, I mean,
that's
and the staff has to be educated.
Have to know
it's a non-negotiable.
Yeah.
Yes, sir. Yes, sir. And you asked a question. You said you were going to ask it to everybody. Did we answer that, sir?
Oh, no, it's in reference to, you guys were aware of or?
The co-op. Yes, sir.
Co-op, yeah.
Yes, sir. It's a similar answer. I mean, we've actually had experience building co-ops. I'll tell you, our largest market in 1921, or TEB alone does 31 different ISDs in the state. 1921, we do a handful. Our largest market is in the emergency service district space. We have 35 emergency service districts. I know they're not ISDs, but they're taxpayer. You know, we got to go in front of a board. We got to be audited. We got to have a colonoscopy every 12 months to make sure we're spending every dollar correct. I'm sure y'all are familiar. You know, so we actually own and operate a co-op that we built with our ESD clients. You know, transparently have not done in the ISD space, but we have done in the ESD space where we have right at 34 different clients there. And we've been, and that really was the first part of the presentation. I say we've been in a lot of boardrooms where board members have looked back at us with weary eyes. I think of Bexar County ESD number 10, you know, this is, you know, fairly close to here. They were facing bankruptcy. They called us transparently. I was on a cruise. I was on a Royal Caribbean cruise ship. And I went into zoomed into their board member meeting, and we were able to turn that around for them in a week's time with me on a cruise. So, I think that's the main thing we wanted to stress is you will get every bit of us forever, but especially over the next 60 days, because we understand the toll that's about to be invoiced to you guys and your staff. We get it, and we're going to work our freaking tails off.
Do you have a question, Sam?
No, I mean, I asked already.
You're gonna ask a question? You guys are, basically, I guess I'm assuming you guys were talking about preventive programs that are built into Blue Cross Blue Shield.
Yes, sir.
I'm a retired TRS member.
Yes, sir.
And I am on Medicare.
Yes, sir.
And I had a rude awakening because prior to retiring, working for the school district, any preventive medication to me was free. Okay. Once I retired, I got into with United Healthcare. I mean, I'm not afraid to say the name. Not too happy. All of a sudden, I'm paying a copay for medications that I was getting free before.
Yes, sir.
And I called United Healthcare, and they said, "Well, sir, to tell the truth, you need to talk to TRS. They're the ones that bought the plan." So, to me, that makes this TRS a broker. So, are you guys going to be looking out for that for our employees?
Yes, sir. So, 1921, we don't do Medicare. I'll tell you that right now. We do group health insurance. That's what we do for a living. But we have close partnerships with Medicare organizations, and we actually bring them along with us to open enrollments. And so when there's a gentleman or a lady that's over 65, we walk them through, hey, here's what the plan is, and here's what Medicare looks like, pricing and coverage. If you don't know, if you've never looked at Medicare is all about the supplement. You got to make sure you got the right supplement in place, and not all supplements are created equal. There's 9 million different options. You go to the Medicare.com website, try to figure out, you're going to get lost. But that's where our team actually sits down with you with a computer, hip to hip. And we say, okay, tell me the drugs that you're on. Tell me the plan that you're at. Tell me the expectation of your plan. And then you play this teeter-totter game of expectation versus price. And okay, here's what I'm expecting, and here's what I'm expecting to pay. And sometimes those align and sometimes those don't. But we want to make sure that they're understanding the decision that they're making at the point of decision, not the point of care.
Questions, sir?
I'm good, man. Good job, guys.
Thank you very much.
Thank you guys for your attention.
Thank you very much.
Thank you.
Juan.
Next we have Robinson Brokerage.
Good evening. Hi. Hello, thank you, President Martinez, Superintendent Grill, and distinguished board of directors. Thank you very much for the invitation to be able to come and present to you all what we do in our brokerage firm. Our name is Robinson Brokerage Firm. I'm Shauna, and this is Jackson. So if you'll open up your folders, we're going to be following along with the document that you're going to find on the right-hand side. The other two documents are just two different time calendars that we wanted to be able to present to you all. We, just as our constituents behind me, are firm believers that you guys are, need to go today. We know what we're doing. Obviously, this is our industry, and we know that y'all are on a short time constraint to be able to get the very best prices. That being said, I'm going to go ahead and jump right in and get started. So predictability the right way. What does that mean? I'm not going to bore you with a whole bunch of insurance language because it's complicated and it's hard to describe. And I think my counterparts have done an excellent job of really laying the foundation of what insurance is. But what we're going to do that is going to be able to get you to the rates that you're looking for tomorrow, and we're going to go over to those here in just a minute, are going to be contractually guaranteeing you premiums for 2 years. I know TRS has been thrown around. I don't think that's your best option. And the reason that I don't think that is we know it's going up 12 to 15% every year consistently. It's not going to change. The governor's not giving any more money to TRS. So what you're looking at right now, I think, is about $494 for the primary care plan. What I don't like about it, it has a $2,500 deductible for RX. Before you get to pick up your cholesterol medicine, your ADHD medicine for your children, your birth control for the ladies, you're going to have to spend $2,500 on RX. That is a lot of money for anybody. So that's one reason. The other reason is they're all HMOs. So you're going to restrict who I'm going to go see from day one. Not only that, I have to go and get a referral to be able to see my specialist. So that being said, we want to go ahead and give you guys 2 years of guaranteed premiums. No increase for 2 years. Number two, no deductibles, no co-pays for primary care. Once again, we want your employees to go to the doctor. We don't believe in ER. So we do make ER a little more expensive when we're designing our plans. What we would design for you all is Crystal City ISD network. That's what we're doing with all of our clients right now. We have the traditional Blue Cross, we have United, we have Cigna, we have Aetna, and that's who we're going to wrap your network with. But we would create your own network with negotiated rates with Methodist, because being an old hospital executive from Baptist, I know where you all go. When you're looking for higher level of care, as well as I have negotiated rates with the different regional. So those are two things we've already done. Customizable, expandable network. There is not a doctor in your area that we don't already have in our network. Why? Because we pay more than what your traditional carriers are going to pay. So they want to be in the network. That's not where our cost is. Our cost is with hospitals. So if we can get all the doctors to participate, so your employees are happy, and they're not disrupted with who they want to see for their care, then we've done our job. They're happy, but we've also lowered the cost, and I'm going to tell you how in just a minute, with your overall spend, which is going to be any hospitalizations or large claims. And then once again, cost savings based on leveraging of primary care. We would get rid of one hospital system. I'm going to be honest with you. Everybody can't be in a negotiated network and us be able to get lowered rates. When I say lowered rates, we have Methodist rates right now at 60% of what Blue Cross Blue Shield is paying. 60%. But we have it because we got rid of Baptist. So your employees would have access to Methodist, University, and Christus. Those would be the three systems. Can they go out of network? Absolutely. Once again, you can't at TRS. You can go out of network, but your employees are going to pay 50% of that cost instead of only 20%. We have access to 1,000 free prescriptions. Everything you can possibly think of. I was a pharmaceutical rep before I was a hospital executive. So I went through the list that we have with Attentive with a fine-tooth comb for about 8 hours, and I was detailing out exactly what they all are. There is not a drug that any of us would possibly use that is not on that list, with the exception of if you were doing some kind of in vitro fertilization or something of that degree. Free to your employees. Here's what's even better. With Attentive, everybody in your district, every single employee and family member gets free access to the 1,000 drugs, not just the ones on the medical plan. It has nothing to do with the medical plan. But the beauty of having access to 1,000 free meds, if your kids aren't on your medical plan because you can't afford it, you can not only get them free telemedicine through Attentive and free mental health, 6 visits per person in your family, regardless whether they're on the plan. So now we've got them access to a doctor 24/7, no copay ever, and we've got them free medication. Can you get my water?
Right here.
Thank you. Happens every time. So free medication and free mental health services. And I can tell you, out of all of the program that Incentive offers, I'm going to tell you a little bit more about it in just a second. Those are the number 2 that are utilized most frequently. Mental health, we know, has not only skyrocketed, it's impossible to get a provider. My son had ADHD. We got him tested and we needed medication. So for us to be able to get him to see a psychiatrist with United Healthcare, that's been our insurance for 20 years, it was going to take me 6 months. His grades didn't have time for 6 months. So we paid $350 a month to be able to see a psychiatrist for writing me a script. I have access to every one of your employees and their family members, whether they're on your medical plan or not, starting on September 1st through 10th. That's another thing that we do that's different. We also have 3,000 RX plans that have a 90-day supply, less than $50, whether you're on the plan or not. And the beauty of that is it never hits your plan. What does that mean? Those costs never go against your plan. So if I'm taking ADHD medicine and I've got 3 kids and all 3 of them are getting a monthly script, that cost never goes back to your plan. This attentive program complements your plan, but it doesn't integrate. So those costs are never transitioned over to include the primary care or the mental health. We also have no pharmaceutical deductible and no deductible for imaging or labs. Ensuring quality health care. Next page, please. So what are we going to do that's different? I love the creativity. You have no idea how much I enjoyed listening to both of them speak. First of all, ingenuity, creativity, that's the only way we're going to stay in business. Because for me to stand up here and tell you the same thing means that we just handed you another pie that you can't afford in the first place. So what do we do that's different? Dramatic RX savings. So we're going to take the drugs off of the list for those that we can get for free. We're also going to use international sourcing, so we're able to get those medications at 50% of what they cost right now. Real life example, we have somebody that has leukemia. She's in remission, but she's going to have to take the medication for the rest of her life. We were able to get a $24,000 drug for $6,000. So instead of $24,000 hitting your plan, $6,000 is hitting your plan. Obviously, the employee's picking up 20%. We also use alternatives. We use Medicare, we use Medicaid, we use TRICARE, and we use the ACA. So when we have employees, and usually it's 5 to 7% of your employees that are causing 90% of your spend. I know the gentleman that just referenced how you had several high claims, 3 of them have left the district already, but those are the ones that are costing you $1.5 million. So out of a $3 million spend, half of your cost is coming from 7 different people. So if we remove those 7 people off the plan, we put them on an ACA or Medicare if they're eligible, we've just saved you $1.5 million. You'll never, ever, ever outspend what your premium is again. We're doing it with all of our clients. I have 8 clients that have received no increase in 8 years. We can do it if we manage the plan. I love what 1921 said. They're going to be on site, they're going to be managing the plan. So do we. That's the difference. If you're actually looking at those claims every week, every Tuesday, I'm like this big old insurance nerd that sits and checks all of my claims for all of my clients, which means I also know the clients and I know how to help them, then that's how we start to reduce your overall claims. Shifting those people off of your plan, we're talking 7 or 8 people that unfortunately are causing the increases of what you have right now. Shift them off to another plan, then they're no longer affecting the other 195 people that are on your plan. And then dramatically being able to decrease your premiums with 0 copays. Next slide, please. Oh, okay, never mind. You don't need a slide, you have it in front of you. Preventive care, we talked about attentive. So what attentive is federally reduced program that the government says we can integrate with your medical plan and reduce your taxes by $1,173 a month. Every single employee that you have that qualifies. $1,173. So by reducing that, guess what we do? We're going to increase their net pay. So right now, the average for you all is $92 a month. So your employees are going to get an extra $92 a month on their paycheck. Guess what? It's going to cover half of that increase in that premium. Why? Because we believe we can bring you a primary care plan for $411 with all the things that I'm talking about. Why? Because we're doing it everywhere else. And because we have the contracts with Methodist and Dimmitt and the other surrounding areas. So we believe that we can meet a $411 price for your primary care plan, which means attentive would cover half of your new premium. We have the telemedicine you talked about. Employee assistance comes with attentive. We've also got 3 different Mayo plans, chronic care management, and a program they call Vitals. My son is a diabetic, so he and my daughter are both diabetics. So what you can do with the Neuro, you hold your phone up to your face. Within 30 seconds, it gives you 8 different screenings to include your blood sugar and your blood pressure, and then your BMI and 6 others. And so you're able to see exactly what your blood sugar is or what your blood pressure is within 30 seconds. If you forgot to take your medicine that morning, you don't have to prick your finger. If you forgot your kid at home, if you don't have your Dexcom on, then we've solved that problem for you. You don't have to prick your finger. Once again, every bit of this is free for every single family member that you have. Next page. So where do we think we're going to be able to come up with these numbers? Let me tell you what else we do that's different. So not only are we going to build your network, the most expensive cost in your network is your stop loss. Stop loss probably for you all is probably $195 a person. PEPM. If I can get that under $10, because I'm going to remove those people that are going to be a high risk for you all, we're talking about 7 or 8 people, and put them on a plan that's better for them and their family, I just reduced the cost of your stop loss to under $10. That's how we're doing what we say that we're able to do. That's why I can assure you of the prices that we're talking about today. Because of all the different things that we bring to the table, as well as on-site enrollment, we're going to sit down with every one of your employees. We're going to bring Spanish detailers as well as English. We're going to do an info session a couple days before. We're going to give every one of them a book that details out exactly what their benefits are going to be. Then we're going to go through what their benefits are. We're going to tell them how to use an FSA, how to use an HSA, and how to use a TNF. And have them put that phone number in their phone right there, because guess what? When you need it's when you can't find the phone number. So if we have everybody go and put it in, free telemedicine, free mental health, then we don't have to worry about if they can find it or not. So you can see there the price comparisons that we feel confident we can bring to the table for Crystal City starting September 1st. And right there is your Blue Cross, what you currently have, what TRS is, and we know that that'll go up every year, and then where we believe Robinson Brokerage Firm would be. Right there shows you what the employee cost would be after your contribution of $225. You're looking at about a 59% savings. Next slide, it's been done before. So this is nothing original. We're just excited to be part of it and be able to create what we need for our clients to be able to meet their needs. What's most important to me is access to care and affordability. Because I tell everybody all the time, if your deductible's too high and you're a good card-carrying member and you've got it in your wallet but you can't use it, you don't have good insurance, right? So all of these different school districts, and I just listed 8 because we've worked with most of all of them, are doing exactly what we're describing to you all today. Next page is Greenville ISD. The reason that I put this one in there, they've got the 0 deductibles. They've got 3 different plans to choose from. We also build into the high deductible healthcare plan that nobody else is doing. We have an exclusive, what we call a bundle. So if you choose the high deductible healthcare plan, you're going to get an accident plan, a critical illness plan, and a hospital indemnity all built into that. Doesn't cost you a penny. We integrate it with whatever the premium is. So guess what? You've got that high deductible, which right now I think is about $3,400 according to the federal government. Then you're going to be able to pay down that deductible by having those 3 plans that are wrapped into your high deductible healthcare plan. You're not going to pay a penny for it. So what we're trying to do is always think ahead to make sure your employees have access to care and affordable care when they need it. Greenville's obviously in the most expensive area. This is your Dallas-Fort Worth area. They are the most expensive in TRS. So you can see there what their rates would have been should they stay in. Almost a $200 savings for that base plan with a 0 deductible. You don't need a low deductible. I know you guys have about a $500 deductible right now from Cross Blue Shield. Although it's nice to have, about 8% of your employees will ever hit their deductible. That number is very small. So having a lower deductible and increasing your premium is really the absolute opposite of what you want to be able to do, particularly long term. Instead, take that 8%. Let's move them onto a plan that's better for them and their family and maintain your premiums. Next slide. We believe we have a solution. Experience, undisputable, no premium increases, 24/7 customer service for all employees, and our firm does have an exclusive brokerage partnership with Attentive. You can see right here what Attentive would be able to do for you all. District savings is only $4,000, right? So whatever the taxes are that you all are paying to match your Medicare rates for your employees, we would reduce your taxes as well. So it just gives you another $4,000. Your foundation would receive $9,000. They like to give $4 PEPM per employee per month back to the district to put in your foundation, and they do that at the end of the year. The savings annually for your employees would be about $214,000, like we said, an average of about $92 per employee per month. And then once again, that district savings being about $4,000. So that being said, just want to go over the page that you have right there in the front. We are on Region 19 by work. So if you all decide to move forward, we have the capability of coming on board today. We have a CARES program that we described to you all. We have the HVAC bundle. We have Attentive that's going to put more money in your employees' pockets, reduce the taxes that you all are paying, as well as give your foundation more money, give them 1,000 free drugs, 3,000, they're going to be a 90-day supply under $50 for everybody in the family, not just the employees on the medical plan. Remember, it has nothing to do with your medical plan. It complements what you currently have. We're going to have no HMOs, so your employees can go where they want and have open access. We also have free telemedicine, free mental health for everybody in the family. We do use the International RX, which is able to save our employees dramatically, about 50%, to include those GLP-1s. And we are the exclusive broker for Attentive. Right now, our average cost for our employees for that family plan, the primary care plan that we just talked about, is right at about $400 for most all of our clients. So I feel very confident with $411 for you all. And we would do a network contract with Methodist and Denton Hospital. Anything that I've forgotten that you want to throw out there?
One thing that you will notice on the rates page in this presentation is currently your cheapest plan is your high deductible healthcare plan. As we all know, the federal government has set the deductible at $3,400. You don't receive any benefits until you reach that $3,400. Well, currently, most of your employees are enrolled in that high deductible plan because that is the cheapest plan, right? That's one of the only plans they can afford. What we do is if you look at the comparison breakdown, on the primary plan, which there is no deductible, right? There's no pending deductible. That's going to be the cheapest plan that we offer here at Crystal City ISD. So you'll see a large switch from employees enrolled in a high deductible plan over to the primary plan because those benefits are much richer, but that is now going to be the most affordable plan. And then here's just, I don't know if everyone got to see this. This is the benefits booklet we would create for Crystal City ISD. So it gives you a good breakdown of your costs and then a good breakdown of each medical plan right here.
We anticipate we would be on campus in your district for no less than a week. We're going to see every single employee, and that's important, and it's important for your 1095 and 1094s as well, that we can prove that you all have offered affordable insurance to at least 96% of your employees. So we like to make sure that we track down every single employee, even when we're calling on the weekends. And last but not least, you all ask a few different questions. You ask if we work with anybody else that's under TEA. We do. Southside ISD is under TEA, and South Sand is currently under TEA. And work with both of those boards as well as the superintendents about on a weekly basis, I would say. We believe in knowing your employees. I can tell you right now stories at every one of our school districts, intimate situations that are going on with their employees, because not only do we take calls 24/7, people try it. I always tell people, try us out. My entire team gets the calls that leave our office on their cell phones. And so they're all assigned to a day, and then somebody has a backup. Why? Because if you're calling us at midnight, you're standing in the ER with a baby running 105 fever, and you can't find your insurance card. So we're going to answer your call. I've answered it at 4 a.m. I've answered it at midnight myself. That's what we're going to be able to offer to you in regards to customer service. Reconciliation is never an issue. We have Employee Navigator, and we have an integration, an EDI feed that integrates directly with all of the different TPAs and carriers that we use. The reason that you guys don't have that right now is because it's a cost to the broker. Blue Cross Blue Shield charges us to integrate. We pay that cost for you. We're never, ever going to do without an integration. What that means is the minute somebody turns or the minute somebody starts at your school district, we're sharing that information with that medical carrier the next day. So it's a real-time feed, so you're never, ever going to be paying fees because somebody wasn't removed from the plan. And the reference-based pricing, not a big fan of that, only because of the fact that you are deciding what you're going to pay a hospital, and hospitals don't always like that. So sometimes lawsuits are unfortunately added on to that. It would just be sticky for the employee. We want to make sure that we come in with negotiated rates, that we've got contracts that are affordable, and we're able to offer that to employees up front. With that being said, do you have any questions, thoughts?
Could you walk us through your calendar here?
Yes, sir. So we have a June and July. So we went ahead, regardless of who you choose today, we really urge you, for the benefit of your employees, make your decision today. Get that BOR, that broker of record, and let whoever you all choose start tomorrow. It's in your best interest, and in that way you also are able to place the ads in the paper that you're supposed to do, and do everything just as your procurement team would want you to do in regards to legally making sure that you'll have posted the position. We would drop the medical insurance tomorrow. We already have something put together and written. This is what we do for a living, and write many of them. We would also go ahead and post it in the paper just to make sure that everybody's aware that it's posted. We would send it out to every one of the carriers starting tomorrow, so they've got time, once we receive your claims, to be able to go ahead and start repricing. It could be an Aetna that comes in. We believe that we have 3 different networks that we create and we're able to be innovative with, that we could get much better pricing, get you down to that $411 primary price, and then be able to use all of the other different creative things that we have. And then administration, we would present to you all on the 13th of July. That I think is also possibly a board meeting for you all. And then we could either go ahead and present to the board that night for a vote, should your administration agree with what our decision is, or call a special board meeting maybe the next week, and then be ready to enroll the second week of August and be able to be on site here for the week.
Let me just recount what you just said. So there's 2 calendars in your packet, and 2 different scenarios. So one is if we make a decision tonight on the broker, we follow that timeline. If we wait till the July 13th board meeting, we follow this set of timelines. Correct?
Thank you.
Okay.
Questions?
You're worn out with insurance talk at this point, I'm sure.
I guess my only question is regarding, how y'all get paid as well.
Yes, sir. So just like the other 2. Yes, so we're all paid on the PPM, and that never ever comes from the school district. So we don't ever receive any monies that come from any of our clients. So commissions are all built in. The state of Texas requires that our carriers file their rates with the state of Texas, and our commissions are always built into that. So you're never ever passing on any kind of fees to the district or the employees.
I'm sorry, can you explain again on the 0 copays?
Yes, sir.
Oh, that as far as what, the primary care physician visits?
Yes, sir. So we highly encourage people to see their primary care doctors. We want everybody to have one. We're those crazy people that call you and ask you if you've done your annual physical, and then we get a doctor's appointment for you if you haven't. So we believe if we give you a 0 copay for your primary care, then you're going to go, and you're really going to go when you don't feel good or you need it.
Last one is on the Affordable Care Act, the ACA. I thought that had expired. I thought I saw that recently.
No, it went up. But the beauty is that our program picks up the majority of that cost. We have a program called CARES. So the district is not going to be inheriting a large sum of money. We're hoping that maybe President Trump decides to renegotiate those rates for January 1st. But no, I think it's here to stay forever. Coming from a hospital system years ago, I've been doing insurance now for 10 years. But coming from a hospital system, many of those folks that walk in the ER through EMTALA don't ever pay their bill. And so hospitals are left, with big significant dollars that are never refunded. And so ACA has helped out with that. And even though I think we can always improve our health insurance and make things better, it's definitely been a compliment to what we have.
Thank you.
I guess on your slides, the employee savings and current rates, what you're saying is that our employees will be paying $93
Per paycheck.
per paycheck?
Yes, sir. Yes, I want to be very clear. The staff asked us to put in exactly what they would be paying, seeing as you all are paid bi-monthly. And then remember with a 10F, that average of about $92, it would almost,
Take away
right.
benefits.
You also mentioned that y'all, or there's money given back to the foundation.
Yes, sir.
Okay. And what if you don't have a foundation in place?
Well, we give it to the district and you all would decide where you want that to go, or you could choose a foundation that y'all work with. What they want to do is they want to give it back. So here's where we've seen people use it. Scholarships for students, seniors, computers for seniors that are leaving. We've seen people give it to teachers to decorate their classrooms or to give incentives. So it's really up to you all how you want to use the money. They want it to go back into the education system.
Just want to make sure. I don't know if I misunderstood or it sounds almost too good to be true, really. As far as the family getting access to medications or healthcare that I enrolled, could you give an example or maybe explain to see if maybe I've understood right?
So
Go ahead, I'm gonna grab the list.
a good example is a lot of times you'll see the single mom that has 2 children can't afford to put her children on the plan, right? Well, under attentive, they do not have to be insured under her plan. They still have access to telemedicine 24/7, and then this is the list of all the drugs that they would get at no cost. And then the one list is the 90-day supply for under $50. One thing that we do during info sessions that I always love to point out to employees is you're out with the flu or you're not feeling well. Well, let me be able to educate you on everything you have access to, so that instead of maybe going on the street waiting 45 minutes to get in front of your primary care doctor, possibly paying a copay. I know they currently pay a copay. Instead, call Intensive. That's free, 24/7. And then if the medication that you need is on that list, that's another savings. You know, so it's being able to really get detailed with the employees. That's the main focus.
All right, thank you. Yeah.
Did you see my scribble there?
Thank you.
Does anybody else have questions? Or
I'm good.
I don't have any additional questions.
Mr. Grill, anything else? Yeah, I have some wrap-up statements to make after they're finished.
Thank you.
Thank you.
All right, thank you.
Thank you.
Thank you.
Okay, board, just comments and procedurals here. So I did ask our team, business office, and HR to have conversations with all three of the people presented tonight. So that way they would all have an opportunity to present and provide opportunities for us to understand what they provided. So with that, we did challenge each of the brokers to use the TRS Active Care as our baseline model of what we were looking for. The entry level employee only is $490. And currently our company's insurance that we pay 100% on is right at $780 a month. So again, knowing that our employees weren't going to get $780 a month, now it's going to be $225 a month. That's quite a bit of difference for our employees, and we want to make a decision to help our employees see that we're wanting to take good care of them, both physically and health-wise, and in their pocketbooks. So to evaluate the brokers this evening, there's a couple of decisions you can make. You can either we can table discussions and either call a special board meeting or put this on our July 13th meeting. Now, the downside to waiting too long is the longer we take, the longer they take to get us set up and running. And so with that, all three brokers meet one of our procurement guidelines. So in board policy, there's 7 procurement methods, and 2 of them are applicable in tonight, possibly in decisions. So, 2 of the brokers, our Region 19 co-op for health insurance carriers, and then 1 meets the RFP criteria, which also would be applicable to. So in other words, all 3 are eligible for us to make a decision tonight. You would just want to make sure that you want to make a motion tonight that we make that.
I have a question. I mean, you said that Yeah, business office and some people with all three of them. Was there a recommendation from them since probably was more time spent with them?
I think they were all three given any answers that we could give them to the requirements that we were seeking.
Did all three, look, did every broker receive the same information and, you know, it's the base,
That was my directive, yes. I wasn't physically involved in all the conversations. I did meet with 1921 and Robinson brokers prior to tonight. I did not with FFGA, but we did have a phone conversation.
just Higginbotham or existing Curry didn't come in.
We met with them in June, and they told us they'd get back to us in 2 weeks, and that's been a month ago. And we did look at TRS Active Care, but their deadline to sign up was in December or January 1st, so we would have to wait until this coming December if we wanted to change to TRS Active Care, which I think at this point in time isn't the right thing to do. I think we need to make a decision, whether it's tonight or in the very near future, but time's of the essence.
Right.
You have a recommendation?
Can we go into close session?
I mean, can we have a conversation amongst us, you know?
All means, so you have a recommendation?
We don't have closed session.
We do have closed session.
And this technically doesn't meet the requirements for closed session either, because it's not a personnel matter.
It's my question, the 921, based on timeline, when would you guys start? Would y'all start tomorrow, decided today? And I mean.
Technically, we've already started. We've already got that decision right now.
And those negotiations is the same price you currently pay now, or is it looking to drop down?
Absolutely.
Dropping down?
Yeah, and the biggest thing is just when that fully insured market is trying to get you somewhere we can stabilize it. That would be priority number one, to try to stabilize your costs as absolutely as fast as possible.
Okay.
Yep.
Y'all wouldn't be able to provide a rate, right? That's one of the biggest things I think we're looking at, right? In terms of insurance right now is a rate to our employees. You know, that's my main priority right now. I think kind of save them some money because like you mentioned, it is a big shock in terms of, the district covering $770 going down to $225. It's a big shock to our employees. Whatever rate we can get, or if anything, y'all are pretty comfortable with saying, I guess the $90 or $94 per employee per check, right?
Yes.
So about $200 out of the employee's pocket, correct? I don't know if you guys are comfortable enough with saying a rate or not. If we're
I'm assuming that's after the employer contribution.
Yes.
Yeah. I mean, looking at your data right now and with your adjusted MLR, yes, sir. We confident we can get that price pretty well.
And the fully insured market is going to be different than a self-funded market because that is going to be a potential rate, right? Whereas in self-funded, it could be much higher, it could be even lower, but in fully insured, it's going to be a fixed cost.
And we're looking at level funded, so
It's
we
really-
would never, ever recommend you go self-funded.
So, and that's a good point. So, Shauna, you brought up level funding. How about you guys, JJ, Zach?
Yes,
Is that what y'all are?
We have both got this out of bid right now. Yes, sir.
We're fully insured, level funded, and self-funded.
also the FFA and FFGA, as far as rates and things, same question. Are you comfortable with possibly giving a rate now or not? Or, I don't want to put you on the spot.
It's not putting me on the spot. So just calculate your total premium. It's around 2.2 million, give or take, right? You're at 100% loss ratio, right? So that means that 2.2 million is covering the entire spend. There's no room for administration, right? You gotta pay people for doing the job or do claims. Okay. Now think backwards. You have to get down from 2.2 million to 2.1 to 2 to 1.9 to 1.7. You got to get your claims down there. And then you still have to make room for the administration claims. Mathematically, How is that possible? That's how you build the rate. So we're not be able to guarantee your rates, or give you anything close. I haven't seen the data. Even though we're running at a 1% loss ratio, has enough to tell me that based on your premiums, where I can set the target at, if I can save 30% on claims, well then I know I can go 30% lower. Then adding back the admin, right? So it's all based upon the variable claims. So I wouldn't really make a empty promise of the lower amount. I could say, sure, absolutely, we could get them lower. By how much? By close to TRS? We'll just do the math backwards. The TRS is $470. Multiply that. How much does that equal in variable claims expense? You really think that the variable claims will be that low to substantiate all the money that we're taking in? So that would be the honest answer.
So Victor, when would you have rates? When could you have those rates?
So as soon as you go through the data, 2 weeks.
When could we start if you were awarded the bid?
When could we start if you were awarded the bid?
Tomorrow. So you give me the data and I run with it.
Okay, so Zach, you, JJ, y'all talked October 1, Shauna, y'all said September 1. So I'm back to Victor now. What's the difference here?
I'm sorry, once again, y'all's effective date, October 1st.
I believe, Mr. O'Donnell, when's our effective date for insurance? October 1st?
So we wouldn't cancel Blue Cross before that. It would go live October 1st.
Okay.
Okay.
We would. If you cancel Blue Cross, I'd give them a notice. We just did it with another district. Otherwise, your employees are going to start eating that September 1st unless y'all plan on going into your new calendar year with that contribution.
Is there a cost associated to that?
Yes, sir. Everybody has a 30-day out.
So for the board's sake, the $225 a month contribution would start September. The majority of our employees are on 10-month contracts, so they work September to August. So their work cycle is September to August, but they actually said that wrong. Their work cycle is September 1st to August 31st, but we start back to school in August. So for our 10-month employees, they would get $779 for a contribution for the month of August. Then in September, it was up to $225. Whereas our 12-month employees, that starts next month, July, which is this week.
That's right.
Contractually speaking, yes. So their contributions are going to drop to $225 in July. And then we have a few administrators who are on 11 months, and they would drop down in August to $225. So you do have some employees, but they're the higher paid employees too of the district that theoretically could absorb some of that cost for a couple months. But Sean, you're saying you can make it happen by September 1?
Yes, sir. We would send Blue Cross Blue Shield a cancellation notice towards the end of July for a cancellation of August 31st.
And just for the sake of conversation, we can go live. It really, like the carriers, it really makes no difference when you go off. What's not a switch. We just wanted it to align.
Victor, trying to play fair here.
When can you go live?
Same day.
Same day?
If you're canceling the Blue.
Yeah, everybody.
Anybody can?
Decisions.
Does anybody have?
Let's see. Great points, everybody, really.
Anybody have comments to make? I mean, we're going to go through the whole voting process and everything. If nobody has any other questions for the brokers, I guess we can move on to item 6. 6A. So Mr. Grow, for the 6A, as far as consideration and possible action for the procurement method.
So if the board's ready to make a decision tonight, it would be wise for you to choose the procurement method. In this case would either be the procurement method that I placed in your board packets. So there's 7 of these listed here. And the 2 are in bold print: request for proposals and interlocal contracts, which is a purchasing cooperative, which puts any one of these 3 brokers in the opportunity for being awarded the bid if you don't want to make the decision tonight. Or if y'all want not to, then we would discuss it in the journal.
What you mentioned was that FFGA and Robinson are already a part of the interlocal agreement with, or the local contract with Region 19, right?
Correct. They're in a purchasing co-op.
Purchasing co-op. 1921 is not part of
TEB is, and it was still RFP.
okay. I don't know.
And y'all also meet the criteria for RFP. So, in other words, all 3 will be opportunistic for this. We would just make the decision on which procurement method, which would then lead to the decision which broker.
Okay. Choosing one wouldn't cancel one out.
Correct.
Okay.
Zach, are y'all on a purchasing cooperative? Okay.
TEB is.
So who are we hiring, I guess, then? Is it 1921? Okay. But in other words, if you do want to go with 1921, then the RFP that we've had posted on our website.
Well, I think there's different decisions, I guess, kind of. So we can choose a procurement method which would allow everybody to take place, that we have here. I mean, we can go ahead and I need somebody to make a motion. What procurement method would you recommend, sir?
Well, again, the RFP would be for 1921 and the interlocal contract purchasing cooperatives for FFGA and Robinson. Okay. So I think it really boils down to who do you want to award the bid to. The procurement method is tied really back to who you want to hire.
Mr. Grill,
Yes.
this is Sylvia Reyna. I am so sorry to just zoom in. I just flew in from Mexico and I am literally at the airport, so I do apologize. But I do have a question, very briefly. Does the board have any kind of a selection rubric or selection criteria that you all are looking at to evaluate each one? Because I know obviously they are all very good entities and certainly want to be fair, as you said, Mr. Grill, with all of the vendors. Is there any kind of a selection rubric or guide sheet that y'all have been provided?
No.
To make the decision?
To
Okay.
answer your question, no.
Okay. Just wondering, what is it that you all would consider to be the most pressing, perhaps pressing issues that you want? I've heard everything from, we want the obviously the price to be reasonable. We also want it to be able to start on September 1st. You want them to be able to have a good overarching plan to meet most everyone's needs. So those are all those criteria that you would be looking at. So just kind of keeping in mind, what are those main areas such that you can make an informed decision. And if you feel comfortable to do so, of course, you're able to do that. If not, then perhaps take that to another meeting. But of course, that's your decision.
Oh, yes.
Should I have a reference in the RFP? There is a metric system. It's new back. It's a point system. It's up to 100 points. I believe it's 5 categories. That may not be what the individual owner is referencing, but they did want to bring that to the attention of the board.
Oh, the individual is our conservator. Is one of our state conservators.
Okay.
Dr. Reyna.
Yes, sir.
Oh, no, I was just mentioning that you were one of our state
Okay.
conservators.
I'm sorry.
He was
I'm
identifying
sorry.
who you were, the voice. And
I know. And I really apologize for the circumstances. I'm literally on my phone trying to just listen to you all. So that was on my only comment. Thank you.
Take it to another meeting. That's one option. If you guys are ready to decide.
Guess I need a motion. If we're ready to make a decision, you can take a motion.
Mr. President, I move that we get requests for proposals, RFPs.
That's the. And that's an item 6A, correct? It's item 6A?
Yes, 6A.
We do have a motion. Do we have a second?
What was the motion, I'm sorry?
The motion was to move forward with the procurement method of RFPs, request for proposals.
That's for who?
It's being suggested an A?
Yes.
I second.
Motion made by Mr. Bonilla, second made by Mr. Mata. Any discussion?
And that RFP is for 1921 and
Well, the
FFGA?
I believe what the RFP is, everybody has to adhere to the RFP method.
Yeah.
Right? So it'll give an even playing field for all three to be able to follow this procurement method. The other procurement method that we were looking, or that was described, was the interlocal, which was already have passed the state requirements and have gone through a procurement method with the state. And so they sit on a region, I guess a region 19 buy board. So other districts can pull from those pools to use.
Yes, it doesn't have anybody out.
No, the RFP doesn't rule anybody out. It includes all three that are presented today.
Okay.
And I don't know if it would allow for others to.
Now, may I suggest though, if y'all aren't ready to make a decision tonight, then we don't need to decide on the procurement method tonight.
Honestly, I think we should make a motion tonight. I mean, I don't want to happen what happened last year that, I mean, we were running company we hired flying around and all over. I mean, and I don't think the teachers were given an opportunity to really look at what's available. If we vote tonight, I mean, they'll have plenty of time to, I think it's their motion.
Well, right now on the table, we have a motion for the procurement method to move forward with the RFP. And we have a second. We have discussions on it. Is everybody,
You're right.
You want to offer an alternative?
No, I mean, we approve it, we can still approve.
Yes. We'll approve the.
Yeah, but we can still go to,
Yes, what Mr. Grill was saying, that if we're not ready to make a decision on our insurance broker, he recommends that we do not take action on a procurement method.
And if I heard correctly, if we go the other procurement method, the one there with cooperatives, we'd be only considering two.
If you're making a decision on one, then it really just depends on which procurement method you want to use there. So, in other words, you can use RFP on all three, but definitely would make 1921 eligible. The purchasing cooperative in Region 19 would make the Robinson broker and FFGA broker eligible.
Well, we have a motion on the table. Second.
Sorry, Mr. Joe, can you explain that again? That last part said,
All right, so if you're wanting to move forward with 1920,
okay,
then you use the procurement method that Victor made the motion for, which is RFP. You can also use the RFP method for Robinson or FFGA. If you want to use the procurement method for the purchasing cooperative, which means they've gone through a straight state procurement method already, and that would just make eligible Robinson and FFGA.
Gotcha.
So, sorry.
No, I was saying, in terms of timeline, choosing one or the other, does it add any time to the process, or?
It's really about if you want to use the rubric and the RFP as your tool, but if you're making a decision tonight, we're going to be sitting here going through the rubric together tonight.
We can just, I mean, go on or what's presented to us.
You can if you choose the right procurement method.
Yeah.
Do you know what page of rubric it was? Too far.
Oh, wait, I'm just trying to look at my phone here.
I see on page 7.
There it is.
5 categories, I believe.
We're gonna make a copy of this.
We're waiting to get the rubric, or this,
Yeah, man, what are you thinking? What are you thinking? Yeah, we can.
They got something that I don't want our employees to go to. I have a profession. Takes every single person on this. But I'm pretty sure we're not gonna benefits because they include used to work
Many years.
straighten it out. And they locked us. I don't want that. What the hell? Every single. Clear it out.
So we make a decision tonight.
Priority celebrating the 4th of July.
Do we have any recommendations?
Thank you.
RFP method. You have to do the numbers and everything.
Actually, I already have my own matrix. Do this. So we're gonna use this one or?
Thank you, ma'am.
So aquí vamos a ver el cómo
And Kay Robinson.
people in the no.
First one, actually, Robinson.
Okay,
Wait, hold on. Yes, sir.
Sir, we have the rubric in front of us and we're seeing the rubric. We have to follow this if we're gonna adopt our.
Yes, I was gonna say, gotta call the question. We have a motion on the floor.
We have a motion and second, discussion's closed, call the question.
I like that.
Huh?
Make an alternate motion.
Yeah.
That we, I guess, approve the, interlocal contract efficiency cooperatives.
Okay. We have a second, we have an alternate motion made by Mr. Houston to approve the interlocal or to approve an interlocal, purchasing agreement or procurement method. Do I have a second?
What was that again? I'm sorry?
Mr. Houston made an alternate motion to, move forward with the procurement method of an interlocal contract.
Okay.
Do we have a second? No second? Motion dies. So we're gonna move forward with the taking actions, call the question for the first motion. We had discussion. All in favor? All opposed? Abstain? Motion carries 6-1. Did you vote? Yeah, okay. Motion carries 6-0-1 to move forward with the RFP procurement method.
Seconded the motion?
Cruz, Mr. Mata. So now we have to fill out the rubric.
So if each of you will fill out the rubric on your own and then pass them this way.
We don't have to put our name or anything.
No.
Oh, yeah.
Number, so.
Oh, you gotta name them. Yeah, you gotta name them.
Someone's still up.
No. So if one of y'all could help us out, we don't know what HUB or SWMBE certified means.
Number 5.
It's historically underutilized business. And we actually do have the certification.
Do you have the certification? Do you have SWBME certified, sir? No?
Twelve 21.
What's that? 1921 has TEB. TEB does. 1921.
They do?
Yeah.
But I mean, that's something that's necessary or something they just made up?
It's on the rubric.
Gotcha.
The other guy in economics.
By three, two,
We have to do the economics.
He's First Financial.
First financial.
The first presenter, second.
You're done with yours?
My left, yeah, I guess.
You gave yours to Mr. Grove? You already gave yours to Mr. Grove.
I already finished. Yeah. I'm good, man.
This is.
The big money.
I don't want to.
Vince, what was that?
Oh, shit, not working on that? Who broke it?
Vince, what's hub and SWMB?
It's sometimes it's a certification, correct? SWMB.
It's a certification.
Oh, okay.
Miss, what did you say hub was?
Historically underutilized business.
Historically underutilized business.
Oh, okay. Over there, right? There was no explanation of it. It's each one. Right up to 20. So
you just want
divided it up by points. But it's water, man. Cause I said that, brother. I just need to survive. Sometimes I think about those ancient settlers. Once you get to the water, you're like, we will purify it. The only thing that would make look for is if there was a dead animal in the water or if it was salty. That's it.
Nothing about bacteria or nothing.
We hard to read mine. Hard to read mine. Pues en algo en Facebook, no se me olvidó, pues sé que
No quiero que siga.
sometime this week, gonna be a ceremony.
Body's dyslexic.
3:00, but I don't know if it's in church. And I don't know if it's tomorrow.
Holy shit.
You're in, Ms. Reina?
Yes, I just got back. I'm on, I lost connection for a moment, but I'm here now.
Okay. We're moving forward with the rubric. Did you want somebody to double check it? Or? Okay. I was looking at you going down the line, so I'm fine with it. I'm okay. Okay. Yeah. Okay. Item 6B, consideration and possible action to approve a health insurance broker. Mr. Grove, do we have a recommendation based off of the RFP?
All right, so the rubric shows FFGA at 47.9 points out of a possible 100. 1921, 77.4 out of 100. And Robinson, 66.87 out of a possible 100. So for the rubric, 1921 would be the recommendation.
Do we have a motion?
I move to approve 1921 as our health insurance broker.
I second.
Motion made by Mr. Mata, second made by Mr. Bonino. Discussion?
I'd like to make an alternate motion.
What's that?
It was a hard
An
decision.
alternate motion.
It was close.
You can make an alternate motion.
My book.
Motion that we approve from Robinson brokerage firm to be our health insurance, not insurance provider.
What's the motion?
Move for a Robinson brokerage firm.
We are health insurance broker.
Yeah.
Do I have a second? No second, motion dies. Discussion on the first motion? No discussion, no discussion. All in favor? All opposed? Mr. Houston, you opposed or
I was in favor.
in favor? Abstain? No abstention. Motion passes 7-1. Health insurance broker for 1921.
7-1?
7-0, sorry.
Time?
move.
7, moved by Mr. Bonilla, second. For adjournment, second by Mr. Nava. All in favor? All opposed? Aye.
Anna, what was our official start?
6:07.
Recording stopped.
25?